As we've noted, patients expect the same experience from healthcare as they do from industries such as e-commerce. These industries prioritize experience and are heavily reliant on digital channels, but in healthcare, we see systems continue to route access requests through traditional voice channels. Now imagine the experience of patients like Jason, Rachel, and Joy, each with different preferences, all forced to navigate the same outdated experience. Rather than receiving immediate support, they're met with messages like, "Your wait time is approximately 5 minutes." But they won't wait 5 minutes. Most patients abandon calls after just 2 minutes, and just like that, another patient is lost in the system, resulting in missed revenue and delayed care. What's more concerning is that this isn't just a one-time missed appointment, it's a lost lifetime value opportunity. After a poor access experience, these patients are far more likely to switch providers entirely, turning an operational inefficiency into a long-term retention issue. On the other hand, an agent is trying to keep up. They're bouncing between multiple systems: telephony, EMR, scheduling tools, a static knowledge base, billing, and none of it talks to each other. So forget about one-call resolution. Even just finding basic information, who the patient is, whether they're eligible, what appointments are available, it just takes too long. And it's a disconnected workflow that leads to long handle times, dropped calls, unfilled schedules, and billions in missed revenue across the industry. This isn't just inefficient, it's unsustainable, and it's exactly what Comet is built to change. So what if access looked different? What if patients could get what they need on their preferred channel at their preferred time without waiting on hold or being bounced around? What if your staff could focus on people and not process? That's exactly what Comet enables. It brings together omnichannel virtual agents, AI copilots, and automated workflows, which serve as the first line of engagement and enables patients to reach out to health systems on their preferred channel at their preferred time. It also removes wait times completely, enhancing patient satisfaction and ultimately retention. Every interaction is personalized, intelligent, and built for resolution. Let's see how this works by looking back at Rachel, Jason, and Joy. Let's start with Rachel. But this time, instead of calling, she can reach out to the health system over web chat based on her own convenience. This time, she's greeted by a simple, smart interface. She selects what she needs to book an appointment for herself, which in particular is an annual wellness visit, and in the background, Comet gets to work. It recognizes Rachel from past visits. It's going to verify her identity. It's going to ask her the reason for her appointment, and it's going to pull up the right appointment types, providers, and slots. Once Rachel chooses a slot, and immediately the appointment is scheduled, the EMR is updated, and Rachel receives a confirmation text with the visit details. Had Rachel needed further assistance with something like clinic directions, parking instructions, benefits and eligibility checks, provider search, or even password resets, that could have been handled as well. It's fast, easy, and it's available 24/7. This is what it means to meet patients where they are. Now let's meet Jason. He's in his 20s, busy, and like a lot of patients, he would rather text than call. He needs to reschedule his appointment, so he reaches out, and just like that, Comet steps in immediately. That's it. No app, no call center wait. It's going to confirm his identity using his full name plus a quick date of birth prompt, and then it's going to pull up Jason's current appointment. It's going to ask his preferences for a new appointment, and it's going to provide him with another appointment slot, confirming the new time, updates to the EMR, sending it a new confirmation by text, and then automatically queuing up any follow-up workflows like check-in instructions or pre-visit forms. That entire flow, personalized, HIPAA compliant, and done in under a minute. This is how Comet turns a missed appointment into a scheduled one without ever touching your staff. Now we have Joy. Joy prefers to talk to a person when it comes to matters of her health. Our AI agents can identify that preference and pass to a human agent via warm transfer or sending to an escalation queue. The moment Joy's call is escalated to a human agent, Access Copilot gets to work. Using caller ID, it's going to auto-detect Joy's number and instantly uses AI insights from her 360-degree profile to show a single pane of glass in view with Joy's most recent engagement. It's also going to show any open care gaps, her preferences such as language and communication channel, her recent visits, her active insurance plans. The agent doesn't have to dig or ask repetitive questions because the co-pilot surfaces what they need to know within a few seconds of the call. And while the call is happening, the co-pilot is listening in real time. Based on the conversation, it's dynamically going to suggest the next best action, knowledge-based articles, and smart responses. Not just that, Copilot can also see that Joy has an open annual wellness visit care gap, and it gives the agent an appointment nudge to remind her that Joy needs to schedule that and make sure that she makes that appointment. Again, what could have been a missed care opportunity is now a booked appointment in just a few clicks. The agent can do that right in the same view thanks to our robust EMR integration. And once the call wraps up, the Access Copilot automatically generates a call summary, fills in the necessary ticket fields, and logs the transcription of the conversation. This is going to reduce the need for double documentation and saves about 25% of the total call handle time per agent while improving documentation quality and enabling better care. Not only can we handle scheduling, but we also address referrals, which we know are one of the biggest pain points in Access. They often arrive via fax or email, and they take 10 to 15 minutes to review. They then require your team to manually extract information, verify insurance, and call the patient to schedule. With Referral Copilot, all of that changes. Let's look at how Joy's ortho referral gets processed. The moment the referral is received, whether from fax, EMR, or intake form, it's going to land in the referral work queue. The coordinator clicks into the row for Joy Lawson, and right away, Referral Copilot has already done the heavy lifting. It extracted all of the key referral details, it's populated the patient header with insurance, contact information, and PCP, and it summarized the referral reason, urgency, and provider requirements, along with flagging any missing data. On the right-hand side of the screen, the AI Insights panel is live. It gives real-time tips to move the referral forward, whether the coordinator is reviewing documentation or live on a call with the patient. In addition to any of this information here, the Referral Copilot can also verify insurance in real time. Need to confirm a prior auth is complete? That's also tracked, with status and comments added right into the platform. Once all of the pre-scheduling steps are complete, the coordinator then updates the status to ready for scheduling, and at that moment, the referral automatically moves to the AI scheduling agent's work queue, no handoff emails, and no delay. Now the best part, our AI voice agent, which supports both inbound and outbound calling. As soon as Joy's referral goes to the AI scheduling agent queue, the scheduling agent picks up from the task from the work queue, and then it's going to initiate a proactive outbound call. Our AI voice agents can reach patients outside of their 9 to 5 workday and reach out on weekends based on the patient preferences, increasing the likelihood that an appointment gets booked. Our voice agents are humanistic, cover a wide variety of patient questions, and support over 10 major languages. So let's listen to what a call actually sounds like.
Hi, this is Sarah, an AI agent from Innovaccer Health. Am I speaking with Joy?
Yes, this is Joy.
I'm calling because your primary care physician, Dr. Patel, referred you to see an orthopedic specialist, and I'm here to help you schedule an appointment. Before we proceed, I want to make sure you're comfortable talking with me as I'm an AI agent. Is that okay with you?
Oh, yeah, that's fine.
Just to make sure I have the right Joy, could I get your last name?
Yes, it's Lawson, Lawson.
And your date of birth?
Yeah, my date of birth is August 15th, 1956.
And is your insurance still UHC Vantage Plan?
Yes, that's correct. That's active.
Okay. To help me narrow down some options for you, can you tell me, do you have a preference for either the Holiday Hills or Main Street location?
Holiday Hills location, please.
And is this appointment a follow-up to an ER visit?
No ER visit.
All right, I've got a few options for you. How about Wednesday, July 30th at 9 o'clock a.m. with Dr. Sam Johnson?
Do you have anything in the afternoon?
Wednesday, July 30th at 1 o'clock p.m. with Dr. Aloha Roberts?
That's great.
So I've scheduled your appointment for Wednesday, July 30th at 1 o'clock p.m. with Dr. Aloha Roberts at the Holiday Hills location. Do you have any questions about your upcoming appointment, or would you like some information about the location?
I would like some information around the location and parking directions.
The Holiday Hills location is at 7 Holiday Hills. As for parking, there's a large parking lot right in front of the building, and it's free of charge. You can just park there and then walk into the building, and our office will be on your right.
Oh, great.
So just to confirm, your appointment is scheduled for Wednesday, July 30th at 1 o'clock p.m. with Dr. Aloha Roberts at the Holiday Hills location. I appreciate you taking the time to schedule this appointment, Joy, and I hope everything goes well. Have a great day, and we'll see that you're taken care of.
2 things were handled on this call: referral scheduling and frequently asked questions. And we can see that the AI voice agent uses provider scheduling rules and decision trees to find the best provider for Joy and integrates with the EMR to write back appointments. With Comet, outbound outreach becomes consistent, efficient, and scalable. So how do you know this is working? Comet makes that easy by giving you a clear, real-time view of how your Access operations are performing. The status quo has always been an agent on a call with a patient for at least 15 minutes or more. Meanwhile, there are 10 patients waiting for more than 5 minutes to connect with an agent, leading to frustration. Frustration then leads to drop-off, which leads to the patient not getting scheduled and thus revenue leakage. We're flipping that. At the highest level, you can track how many interactions are being resolved by AI versus those handled by the staff. You can quickly see where automation is delivering and where additional support or optimization may be needed. The platform also shows how patients are engaging, whether they prefer chat, voice, or SMS, and how effective each channel is at getting patients what they need. You can monitor call abandonment rates, CSAT, how long it takes to resolve patient issues, which gives patient experience leaders the insights that they need to improve services. And for operations and finance leaders, the productivity dashboard tells a powerful story. You'll see how many appointments are being booked, how quickly issues are resolved, what the cost per interaction is, and then you're able to see how that translates into a single ROI view. You're not left wondering if your Access investments are paying off. You can see it and measure it with confidence. And so with that, I'm going to pass this back to Shira and the rest of the panel.
Thank you so much for the demo, Erin.